So, how the government plans to manage the coronavirus pandemic this winter will be set out later on today.
It's also expected that UK-wide booster jabs for the over 50s will be announced. Meanwhile, we've been talking about this morning, all 12 to 15-year-olds in England will be offered one dose of the vaccine from next week. Thank you for all your questions on this. Let's speak to the Vaccines Minister, Nadhim Zahawi, who joins us live on the programme. Appreciate your time this morning. Lots of parents getting in touch, lots of teachers, a few students as well. Can you first of all run us through the science behind this decision around 12 to 15-year-olds in England?
Yeah, absolutely. Good morning, Dan. So you'll recall that Joint Committee on Vaccination and Immunisation, who look at the clinical, and they are qualified to look at the clinical impact on 12 to 15-year-olds, came down on the side that it is marginally more beneficial to be vaccinated against COVID for healthy 12 to 15-year-olds. They'd already given us advice on 12 to 15-year-olds who are more vulnerable to the virus, which we had already begun protecting and vaccinating. But for healthy 12 to 15-year-olds, it was marginally more beneficial, but not enough for them to recommend a universal vaccination programme. And they suggested that the chief medical officers of England, Wales, Scotland, Northern Ireland should then examine the wider impacts on 12 to 15-year-olds. So the mental health impact, disruption to education impact, of course. The chief medical officers did that with the JCVI in the room, plus the Royal Colleges, for example, the Royal College of Paediatrics, the Royal College of GPs. So they have yesterday recommended that because of the additional impact on healthy 12 to 15-year-olds, mental health and other, that we should offer one dose of the Pfizer-BioNTech vaccine, which had already been approved by the regulator, the MHRA, as safe for 12 to 15-year-olds. The way we will do that is through the school-age immunization service, which is very well equipped, has been doing this for years, doing vaccination in schools. The clinician will explain, obviously, to 12 to 15-year-olds and give them the information, leaflets and online, so that parents will get a consent form, either physical, paper-based or online to fill in. So parental consent is required, and then the vaccination will take place. There should be no stigma attached to this whatsoever. We've been very careful. The JCVI has not rushed into any decision, nor have the CMOs. Other countries have moved forward rapidly. So we've had data from the United States of America, from Israel, countries in Europe have moved forward on this. And so we're being very careful how we do this. And I hope that parents will seek out the information that we make available, both as Department of Health and the NHS.
You'll be aware, I'm sure, there is opposition within your own party to this. Can I read you a tweet that's been put out by fellow Tory MP for Yeovil? This is Marcus Fish. He says, "Sorry, I have to say, but the Chief Medical Officer, Chris Whitty, does not deserve the confidence of the country in deciding to vaccinate teenagers without good clinical reason. He should resign." How do you respond to that?
Well, all I would say is that, one, the clinical sort of narrow advice from JCVI is that it is more advantageous, marginally more advantageous, to be vaccinated than not to be. They then advise that the chief medical officers should look at the wider impact, mental health impact on those children, of course, school disruption, educational disruption as well. They consulted with the Royal College of Paediatrics, GPs, the JCVI were in the room. All four chief medical officers, so Chris Whitty and the chief medical officers of Wales, Scotland and Northern Ireland, were unanimous in their advice to us yesterday.
With respect, I think Marcus Fish is not questioning whether it was a unanimous decision. What he's saying is they don't have the right to make that decision to vaccinate teenagers without good clinical reason.
Well, the JCVI, the Joint Committee on Vaccinating and Immunisation, looked at the clinical evidence and fell on the side that it's marginally more beneficial to vaccinate children than not to vaccinate. They then recommended that the chief medical officers look at the wider risks to mental health to 12 to 15-year-olds, not the wider societal issues or risk, but the risks to 12 and to 15-year-olds, and have come down unanimously, all 4 chief medical officers, that we should offer the vaccine to children with parental consent.
Do you think this is part of a wider problem, though? Because lots of our viewers are getting touch today. We talked about that comment from the Tory MP for Yeovil. You've got the JCVI making their judgment, the chief medical officers making a different judgment. There are lots of parents out there, and many of our viewers are saying it feels muddled, it feels confusing. It's hard to have confidence in an informed decision.
So what I would say is it's actually much more considered, and we've been very careful. Many countries move forward rapidly to vaccinate 12 to 15-year-olds in France and Italy, and of course in America and Israel. The JCVI didn't do that. They were very careful looking at all the data on first dose and second dose to look at this very rare incidence of myocarditis in healthy 12 to 15-year-olds. They then looked at the clinical evidence and said it is marginally more beneficial to take a vaccine for COVID for that age group that are healthy. Obviously, the ones that are more vulnerable are already being protected and vaccinated. But they said, look, this is outside our qualified competence, and we recommend that the chief medical officers look at the wider impact, mental health impact, for example, on 12 to 15-year-olds. That is, it's not a difference of opinion. They just said you should consult with the CMOs on this, because it's beyond their remit at the JCVI. The CMOs then looked at this very carefully with the Royal Colleges of Pediatrics, GPs, and of course the JCVI in the room, and made their recommendation. So I think, contrary to the view that this is, it's actually very considered and careful, and we didn't rush. Many countries have been vaccinating 12 to 15-year-olds for months now, and we didn't do the same thing as they did. We've been very, very careful, and I'm proud of that.
Okay, can I ask you about some of the practicalities around it? Lots of questions about this. Who decides? Children, parents? Where are teachers involved in all this? Are there forms to fill out? Are there permission slips to sign?
Yes, so the school-age immunisation service, which has been delivering for many, many years successful vaccination programs for children, and will continue to do so, will do the bulk of this vaccination program. In those schools where that is not possible, we'll use the vaccination sites and centres to help add to that service. Now, what will happen is the clinicians will share information with parents, with children, leaflets online as well. Then there'll be a consent form sent from the school in the usual way that schools do it. Some schools do it in hard copy. They'll put a letter for parents to sign. Some do it electronically. So they'll email parents to share information and gain their consent. So parental consent is required. And then the vaccination program.
Doesn't that put a big burden on teachers, though, Mr. Zahawi? That's some of the concerns we're getting from teachers this morning. They're going to get caught in the middle in all this.
No, so that's exactly what the NHS and the school-age immunisation system will effectively take care of. So it's the clinician that will be doing this work. If there is, for example, a difference of opinion between a parent who doesn't want their child vaccinated and a 15-year-old, 12-year-old, 15-year-old saying, I want to be vaccinated, then the first thing the clinician will do, not the teacher, the clinician, will bring the parent and the child together to try and reach consensus. If they can't, then the system that we've had in this country for decades is called the Gillick competence. So the 12 to 15-year-old will then be judged. If they are competent to make a decision, then they'll be able to make a decision if it differs from what their parents. That's in very rare cases. But parental consent and the school-age immunization system is really well versed in delivering this. This is not a new system we're setting up. This is not something that hasn't been tried and tested. It really does know what it's doing and will deliver this in a very, very efficient way.
And when will we see the first 12 to 15-year-old vaccinated?
So the NHS have been making plans that we'll be able to hopefully see the first vaccinations take place after consent, because you need obviously the information and the letters to go out and receive that consent by the 22nd of this month.
OK, so I'm just checking my diary. So that is next week then?
Yes.
OK. On the issue of booster jabs, I've got another when question when it comes to booster jabs as well. So when will they be administered? Because there's lots of questions this morning about is it going to be combined with the flu jab? Because there needs to be that 6-month gap, doesn't there, between the second jab and then when you get your booster jab. How is that going to be worked out? Lots, again, practical questions about how this will actually work.
Absolutely. And the Prime Minister will be setting out more detail on the final advice from JCVI, which we have now accepted. And of course, the Secretary of State for Health will make a statement to Parliament. If you recall, on the 30th of June, Dan, the JCVI gave us their interim advice on this, of how we should be boosting and, of course, protecting against flu, because I am concerned that there's not been much flu circulating anywhere in the world. And in a bad flu season, we could see 25,000 people lose their life to flu. So the JCVI interim advice allowed us to make those preparations. So the preparations have been well underway, and we will be in a very strong place to begin that booster campaign this month, boosting the most vulnerable. And the Prime Minister, of course, will outline the detail of that, plus, of course, a really fit for purpose variant vaccine variant radar system, if I can call it that, and of course the test and trace system that will allow us, I hope, to transition this virus from pandemic to endemic status. But the PM will be saying more on that later today. OK,
and very briefly, I mean, you know, lockdown has been a big part of everyone's life, hasn't it, for the last 18 months. I don't expect you to say a guarantee, because I know guarantees are difficult and things change all the time. But are you confident that we've seen the last of those lockdowns? So you will remember, and I've been on your program many times, when this pandemic hit, the only tool that was effective that we had available to us is the lockdowns, the non-pharmaceutical interventions. The vaccines have changed all that. The vaccines, and we began vaccinating on the 8th of December with Pfizer-BioNTech and 4th of January with the AstraZeneca vaccine, have saved 112,000 lives, over 112,000 lives. 24 million infections have been prevented, according to Public Health England. So the vaccines are our sort of main tool within our arsenal of therapeutics, and of course, a really fit for purpose variant surveillance system, radar system, as I just described, and of course the test and trace system. So I'm confident that we can put some downward pressure on the virus through the booster program and of course flu vaccination program to allow the NHS to be able to cope with both this winter. In a bad flu year, the NHS comes under huge pressure in the winter months. So I'm confident, but of course, it would be foolhardy to say, we rule out anything. It's wrong to do that. The sensible thing to do is to, continue to boost and protect people who are most vulnerable as we transition. I hope this virus, and I'll be back on your program in years to come and say, we were the first major economy to demonstrate to the world how you transition this virus from pandemic to endemic. Nadhim Zahawi, appreciate your time. Thank you.